This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. Another edition of Health Watch. It's that time every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. In case you're headed out, it's really cold.
Whoa.
It's really cold. But this note, we're switching the clocks next week.
Oh,
So
John,
it's-
it can't come soon enough, can
right.
it? Guys, we all want spring.
That's
spring.
right. But anyway, we are here and ready to talk to you at 855-839-1210. Dr. Molly FANTASIA is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always, especially in the beginning of the show, we talk about the who, what, when, where, why, and how of Innovative Medical Associates and how it can help you potentially and your family improve your overall quality of life. And once again, Dr. Molly, a busy week ahead of you.
It's a busy week ahead of me, and I also was concerned about you, John. You came in on Thursday, and I thought, wow, John looked a little tired to me.
Yes.
So I'm
Yeah,
glad
I
we
was.
were able to tune you up a little bit. You apparently had a busy week as well.
That's right. So
we get it.
Got to stop those busy weeks.
Yeah,
and
well,
relax a little bit.
someone said to me, hey, you and John are like the comedy team. You're out there together. You're the team. What are we going to do? You guys got to stay together. I said, don't worry. We got a lot of life left in us.
Right.
Okay? All right.
Okay, so what is it you do?
Yeah, well, here it is, John, in a nutshell. First of all, I have a primary care facilities license here. And what we are is a bunch of like-minded healthcare providers who all work out of our facility. And that's the integrative and that's the innovative model that we use. So we are primary care. We can do anything another primary care doc can do. In fact, this week I had a run on ultrasounds and we did them. So you need an ultrasound. Doc says you need an ultrasound you get. So we can do any of the radiology. We can do any of the laboratory. Actually, I have the laboratory right in my clinic, as
Yes,
you
I
know,
know,
which
yeah.
makes a whole lot easier for us and my folks. So if you need some blood work, this kind of thing, Doc orders it, and we're able to do this. And then I put my 2 cents in with Doc, and I say, hey, listen, you think we can go down a different little rabbit hole maybe? And she'll think about it and say, okay, let's do it. Anyway, these are the things we can do. If you need medication, we can do it. And again, I don't want people to throw away their medication. But the philosophy of Innovative Medical Associates, meaning the healthcare team, is that we want to use the least amount of pharmaceutical necessary to effectuate the medical change, but also keep your improvement of quality of life. And that's where we really excel.
And you do that through the hydration.
Right, through the hydration
And
and through natural substances, the kind of things that I believe God's ingredients I always talk about, vitamins, minerals, amino acids, peptides. Very interesting. These kinds of things are available. They're available in health food stores. The biggest problem is you gotta have the right ingredients, the right types of, I would say, cofactors that are needed with these things to really effectuate the change.
Let's talk about the ingredients.
Oh, sure.
What is in hydration?
Well, it could be vitamins. It can be things as simple as vitamin C. It could be a little more complex like phosphatidylcholine. It really depends. Part of the problem is people go into the health food store. They read something on Dr. Google. Oh, this will help you. Okay, so you go into the health food store, and many times there are many health food stores which we love. I love the little standalone stores. I love the chain stores. You go in, you talk to the people, they put you to the aisle, right? Problem is you take the stuff and you go, Dr. Molly, that doesn't work. It doesn't work because you're not getting enough of a particular constituents to do the trick. How can we ingest everything we need? You can't. Hydration has been around for many years, right?
First thing you do when you go in the hospital.
Right.
They put
there
a
you go.
bag in you.
Why? Why? Because it's ease of operation. You're able to get the material into the patient, the drug, whatever, and effectuate the change rather quickly. Same thing is true with natural substances.
Okay, so let me see if we can make the people understand this. So if you go into the health food store,
Right.
and you get X,
Right.
okay,
You get C, vitamin
Yeah,
C.
vitamin C, but your vitamin C is different.
Well, here's what I want to say. You know I'm going to have colleagues beat me up. There's no such thing. Vitamin C is vitamin C is vitamin C. What is different is extracts of vitamin C, which I believe make the difference, and how you use the vitamin C and how much you're using of the vitamin C, meaning the viability of it. In other words, you take 500 milligrams of vitamin C in your gut, you think you're getting full 500 milligrams? Probably not. Probably not.
No.
And so herein lies the rub. And that's true with everything. The other thing is, just like with pharmaceuticals, you'll see all the warning labels, right? Don't take this if you're on aspirin. Don't take this if you're taking Tylenol. Don't take this. Don't take this if you're taking statin drugs. Same thing is true for nutraceuticals. You want to use things that are compatible with each other in order to effectuate the change and not harm the patient.
So a patient wouldn't know what's compatible.
Not often. It may say, oh, if you're taking let's say a blood thinner, maybe you shouldn't take nattokinase. Yeah, okay. I agree with that. But do you know that?
No.
Okay. And herein lies the rub. And this is where I go with this, John. Look, people, I'm all for taking oral supplements. People come in with bags and bags of them, right? Question
Many
is
times.
many times over. The question is, are they good for you? Are you taking enough of one constituent and maybe not enough of another? And are you using these synergistically? And what is it that you're trying to do? There's the bottom line. You know, when people come in and say, well, I just want to feel good. Well, duh. I want you to feel good too, right? That's what we want to do. But tell me specifically, you want to have less pain? Do you want to be able to run the marathon? Do you just want to go out with your grandkids? I mean, it's hugely different for each and every person.
So how many treatments till you get to that point in your facility would you say you need?
Don't you think, obviously, if you're just coming in because your overall health is great, you've had no challenges in the past 10 years of your life, you're 80 years old, and you think you're doing pretty well, you probably will see a change and maybe have more energy, etc., in the first 5 treatments.
That's it?
That's it. But if you come in and you're in stage 4 cancer,
now
that's
a different story,
we're looking at a different story. Or you come in and you have some of the things I'm going to talk about today. Believe me, it can take weeks before we get to where we got to go. So it may be 15 weeks before you feel better. But I'm going to tell you, most times, even with the pharmaceuticals, you don't feel better before 15 weeks. Right. Believe me.
How do you manage your patients' expectations?
I tell the truth. I say we can't cure anything. Okay? I tell the truth. We can't cure anything, but we sure can improve your quality of life. Now, how quickly that is, I believe in the big physician upstairs. It's all in God's hands, how quickly we can do things. But we work very diligently to effectuate the change as quickly as we can and keep you safe.
A lot of people, and I know they do this on the initial consultation, they say, well, tell me, Dr. Molly, what can you show me that tells me it works?
Listen, I can give you all of the written data that we have. Oh, your cholesterol is better. Oh, your echo shows that you have an increase in your cardiac output. We can show you all that. Bottom line, though, John, come in and start talking to people, right?
Right.
You see where they are. All right. And you know that, they'll tell you, I started to feel better maybe in the 2nd month, or I started to feel better in the 3rd month. You'll hear all variations, and you got to realize we're human. We're human. Most of us didn't get in the condition we're in if we have a challenge overnight.
Right.
And we're not going to solve it overnight. And that's what I tell everybody. Look, the idea is we want to work as hard as we can. And I may ask you to work a little harder too when you leave the office, because you may have to change some of your lifestyle, and that helps. So if you do a little bit and we do a little bit, you'd be surprised how quickly things change.
What conditions work best in your facility?
I don't, you know what, John? I can't answer that. I can tell you that I see a lot of people with autoimmune disorders. I believe cancer is a huge, cancer supportive care has been certainly more prevalent lately. And very interesting. I've been seeing a little more in the way of cardiac conditions, and part of that, I believe, is the stress that people are under right now. We're under such stress with the news and what's going on out there. I'm seeing a lot more depression. A lot more depression. So, you know, what do we see the most of? I can't tell you, but I can tell you that I think there are a lot of people out there suffering silently. And they're going to their physician, and what's happening is many times the doctor said, well, it's in your head. And yeah, it may be.
How many times have you heard that?
And it may be in your head. I have a young woman who's coming back to me after 2 years. And, you know, I had a meeting with her. I met with her earlier. She's exhausted she's gone to 35 interviews with physicians, 35 different physicians.
Wow.
This is no joke, folks. If you come in, you'll see her and she'll tell you herself. I believe she's starting again this week. And ultimately, she said, I realized that I did the best on the hydration.
There you go.
That's how you know.
We are coming up on our first break of the morning. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question for Dr. Molly, or you have a medical challenge that you'd like to run by her, it's very simple. Just call us right now, 855-839-1210. That's our number, 855-839-1210. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, when we're on the program, operators are standing by at Innovative Medical Associates, and the number, 856-489-0505. Again, that's 856-489-0505. When you call, and you can call now, or you can call a little bit later on, or you can call later on today, whenever you call, you want to make that appointment for the initial consultation with Dr. Molly, and it is complimentary. It doesn't cost you anything, and you will learn a lot. Trust me on that one. You'll learn a lot in the initial consultation. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. If you want to talk to us right now, give us a call, 855-839-1210. We're going to talk about another one of your favorite subjects, mold.
Mold.
I'm really afraid of this. Now, this is a serious thing.
No, this is serious, okay? Here in the Philadelphia area, New Jersey, the shore, we know all about mold. But I want to talk about mold. I want to talk about mycotoxins. And I want to talk about occult infections and why a functional medicine team like I have and what we do at our facility is important. First of all, these kinds of things can be related to the environment, right? We know about mold in the house, right? Your seashore, this kind of thing, your environment. But it can also be occupational. I have a lot of my patients from out of town, and even some who are in town who actually have had an occupational exposure to a fungus or a bacteria that has caused them to have a problem. But why is this so important? It's actually the metabolites from these exposures which causes a lot of problems, and it actually then affects the occult, which means hidden, The occult means hidden infections that people have. And how do we know they have hidden infections? Well, because we test for them. We test for the viruses that may cause Epstein-Barr. We test for the viruses that can cause chronic fatigue. We test for certain bacteria, and we see that, and parasitic infections, and we see that many times people come to us and they don't even know they have this mycotoxin. They don't know that they had an exposure to the mold. Very interesting.
Yes, you were telling me before the show there was a patient who had something from Hurricane Sandy.
That's right.
Which
That's
was 12
12
years
ago. But I think she actually had another. She had the mold remediated in her home. She had the mold remediated in her home, and right after that, everything was beautiful, whatever. 5 years later, I don't know if there was another incident where she might have had an exposure. I don't know. But one of the things that's happening now, she's a local person, comes up from the seashore. She's having a lot of skin interruptions. Now, she's gone to many physicians, including her primary. She went to a rheumatologist. She went to an autoimmune guy. She's going everywhere. She went to a holistic person. And I started to really dive into this, and I started thinking, I think she has a mycotoxin, a specific one, and there are a couple. There are some that are very virulent. And by the way, you can also ingest some of these molds in your foods. There are some that we've seen linked to grain. We've seen some that have linked to beer. Okay, so yeah, the spores, we can see this. It's not usually, if you have a great immune system, you have no problem. But in this case, I started thinking about this. Maybe the initial exposure she took care of, but something else might be triggering some of these skin eruptions she's having. And I also, right now, John, I have a patient in from out of town who had an environmental exposure, actually had an occupational exposure around certain livestock, and he had a bona fide mold that we were or fungus that we were able to test and found it on the mycology. Now, this guy went everywhere. He looked terrible. You knew him when he came in.
Yes.
He's my patient.
Yeah.
So he comes in and we do the mycology. We find the problem. We think where the reserve is, meaning where this actual mycotoxin's laying in his body. But here's the thing. You can have a myriad of issues with this, and people start thinking other things. Again, the occult infections, okay, underlying cause, undoubtedly complex. This is where we are.
Okay, we're going to pick that up in just a moment. But first, we have our favorite caller, Frank in the Northeast. Frank,
hi, Frank.
Good morning. You're on with Dr. Molly.
Hey, Frank.
Good morning, Dr. Molly and John.
How are
Dr.
you,
Molly,
my friend?
Not good.
I know.
No, Friday and Saturday wasn't bad. Yesterday morning wasn't bad. By afternoon, stomach started swelling up, the face swelled up, the legs got real bad. It acted up again real bad yesterday. It still carry over. I was just calling to say it was great seeing you again on Wednesday.
It was great to see you, Frank. I'm sorry you're in the condition you're in, though. I got to tell you, you know that.
Well, let me say this: the minute for people who've never been to your place before, the minute I walked in the door, the bar John's Phrases, the fabulous Frank greeted me. And then I heard Dr. Molly's voice, and you came over. And then I met Lana first, the lovely Lana, the lovely Vicky, and the original lovely Linda.
Thank you.
But also Dr. Molly, a lady named Pat came over. And she heard my voice, because I call you so much all the time. She knew my voice from the radio. She's with her friend. She's from outside the city, past the airport.
Yes,
Just Pat,
yes.
if you listen, thank you so much. You said a lot of nice things. I really appreciate it. And I pray for you and your friend. And everyone there is great. It was a great time, and I really enjoyed it. I'm just calling to say thank you very much. Oh, you recommend that medicine for my stomach,
Linzess, yeah, yes.
Yeah. I called my GI doctor. He gave it to me. I started on Friday. It takes like a week before anything happens.
Right,
So it's not working right now.
No, okay.
But,
well, look, Frank. Listen, just try. I mean, again, Doc and I spoke about it, and it's not real new anymore, but it works a little differently than a lot of the other ones do, and it may help a little bit, and I pray it does. Well, you're in our prayers, Frank. You know that.
Thanks again. And
God
John,
bless.
I couldn't make it Tuesday, but I had to reschedule. So I missed
Oh,
it.
there you go. Well, that was the mistake, Frank. You have to come in
know.
on Tuesday or Thursday. That's it. That's
I know. I
all there is to it.
I couldn't get a ride and I had to reschedule and like whatever.
Well, God
Thanks,
bless
Dr.
you,
Molly.
Frank. God bless
Thank you.
you,
I'm going.
Frank.
Good luck with
Thank
that,
you.
Frank. Thank you. Thanks
Yeah,
for the call.
Frank's pretty bad, and again, he has a myriad of issues. But getting back to this thing with the mycotoxins, so the underlying causes are undoubtedly complex and multifaceted. So what happens then? They can garden more attention from the healthcare providers than specifically the mold mycotoxins, and therein lies the rub. And part of the problem is testing for all of this, because there's no standard testing. You can test for mold, but you got to be more specific about certain mycotoxins, and there are several that are so virulent, and I don't really want to go into that per se, but I'm thinking that for my patient with the skin problem, I'm starting those this week. But my patient who came in from Indiana, I saw clearly he tested positive on the mycology, which is a standard test. It's like sending out for a blood test for bacteria where the culture grows the particular problem, and specifically he has a specific type of fungus, and we know now how to treat. And we have treated him, by the way. The doctor treated him with traditional drugs given through hydration. All right, given through hydration, and we believe this is his third week now where his culture has come back negative. But we still see some challenges, and we believe that's related to the mycotoxins. And I've got to be extremely careful about his liver, because the drugs you use to treat these funguses are very, very strong, very strong.
Wow. Does this patient, does he have to change his occupation, or what do you think?
Well, I think he is. I think he's not going to go back to work on the field. What I'm saying.
Yeah.
He's going to be inside doing a little more work, book work. But here's the thing: we know that what can happen is you can have so many particular issues, and they affect the brain. You can have brain fog. They affect digestion. You can have things like diarrhea. You could have things like other challenges, GI challenges. It affects the immune support. It can cause a problem with your immunity. And in his case, we really thought the immunity issues were the big ones. And here's the other thing, John, about this. It's more like a seesaw effect. Okay, you can have an immune thing where you go into overdrive, right? Or you can have a suppression. And therein lies the difference. In other words, we can have a situation where the immune system turns off or where the immune system goes into overdrive. Either or is bad. What do I always tell you about? Goldilocks, right?
Just enough.
Just enough. So in his case, what we have to do, John, is really look at detoxing him, right? We need to detox the liver too. In this, we need to make sure that we treated the particular fungus, and we need then to look at the co-infections that are going on. And I think this is the way we're really approaching this. So you can see, John, you asked me, how quickly can we do this? Well, he's on his 4th week right now, and he's staying here, by the way. We have a relationship with a particular hotel, so we're able to put our patients up and do this correctly. But I've got to tell you, these invisible illnesses are really the issue. The invisible illnesses are really the issue. And that is the problem. So when people are struggling with certain and they can't put their finger on what the challenge is, we really need to look at that and start to think, okay, what way does the physician have to go? This is why I find environmental medicine is the overall term, but really it can be an occupational medicine problem. So you got to start thinking about the patient. Look at the patient's archaeology and go back. And then look at the particular body systems that are affected and relate that to the mycotoxin exposure and the magnitude of the exposure.
And with that, we're going to take a break because we're at the halfway point of the show.
Oh, wow.
You've already given us a lot. You're going to give us more.
I am.
It is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, if you have a question for Dr. Molly or a medical challenge, 855-839-1210, 855-839-1210. We're coming back with more of today's Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, and if you would like to reach them, you call 856-489-0505. That's 856-489-0505. And the best thing you can do, really, very simple, make an appointment for the initial consultation with Dr. Molly, and it doesn't cost you anything. It's complimentary, and you'll find out a lot about whether she can help you or just in general about what she's all about. 856-489-0505. That's the number, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones. Joanne is in Langhorne. Joanne, welcome.
Hi,
You're
Joanne.
on with Dr. Molly.
Hi, Joanne. How you doing?
I'm okay.
Good.
I'm calling about my daughter-in-law. You know, I've been trying to get her to make an appointment. She's, you know, in her mid-40s, 45,
She's a baby.
46.
Baby.
Yeah. And she has a 5-year-old, you know, my
God bless
granddaughter. And, you know, they were living in Italy, and she came home, you know, she was diagnosed there with lupus and rheumatoid arthritis.
Right.
She has limited mobility. Her, you know, arms. She can't really pick up a salad bowl. I mean, it's,
oh my goodness.
It's so sad. Like she's hurt, and her 2 of her fingers are down to her palms.
Oh my
and
goodness.
The other 3 are sticking up.
Oh my gosh.
And you know, she has autoimmune.
Right.
And I've been, you know, and she's, you know, they're like, I don't know how to say it, tree huggers. You know, they never want to take medicine or
I understand.
anything. They, you know, they like to live a sustained lifestyle, and they really. So I, you know, she went to this holistic doctor in Tampa.
Yeah.
And he told her to juice and to you know, she just juices, and she's a rail. She's skinny as anything.
Right.
And you know, I'm constantly praying and worried about her. I'm just so worried.
You know,
and
look.
So I you know, I come home from church on Sunday, and I always listen to you. And I tried to gave her your name and all, not that long ago. And I don't know, maybe you have an idea how I could get her to.
Well, I can only tell you that I see actually someone who works with me has lupus, and I can only tell you that she started as a patient of mine, and she's now actually she volunteers to come into our facility, and she helps out. You know, lupus is a very interesting autoimmune disorder. I know the place that she went to in Tampa, of course, very fine physicians. I believe I have fine physicians, though, as well. But our approach is a little different in that I also believe that we could use a subclinical dose of a particular medication. You hear me talk about it all the time. In terms of the LDN, low-dose naltrexone, you know I spoke at the recent conference. I'm a big proponent of using that along with some hydration. I think she needs to look at these neurodegenerative, absolutely. And I would probably look at things like phosphatidylcholine, liposodium glutathione, and several other things. I mean, she sounds like she's not an easy case. It would be interesting for me, too, to see, did she have any environmental studies done, too? Like, was she exposed to...
Years ago, before she married my son, she was in the Peace Corps. And she had parasites at that time.
Yes, I believe it.
And then, so she went to, she goes to University of Penn, and
of course,
she goes to, I think, somewhere, but she won't do anything that they prescribe, like as far as medicines.
There are so many.
She feels like the medicines are going to put her in a wheelchair. But
listen. She's not. Listen. I would love to talk to her. I say you don't throw out your medication. You've heard me say this a million times. There are many ways to, listen, I believe there's always another bus. There are many ways to handle the use of the medication. My docs are experts in this. We work together as a team. I think there are some things that can help her oxidative stress. Help her. I wish she would come in for the free consultation. I can't do anything else but say you can have 20 minutes of our time for free. And I think she would find it very interesting, and she'd get to speak to other lupus patients. We can't cure lupus, but I'm going to tell you, I don't think any of the big institutions are curing lupus. But could we give her a little more quality of life? The answer is yes. May God bless you. We'll be praying for you.
I mean, thank you. She feels like the juicing is kind of hydration. I think that's like kind of.
Hate to tell her it's not.
You know what? Sure,
she
hydration.
Can't go on with this juicing. She's so
I'm going to tell you something. The juicing is a wonderful thing. You know, you've heard me talk about, for my cancer patients, we believe in 14-hour fasts. I mean, there's a lot of ways to do this, but I'm going to tell you, it's like a drop in the ocean. We're talking about true medical hydration. I would really love to see her. God bless her, and God bless
Joanne,
your family.
Thanks for the call. Thanks for the call. Really appreciate it.
Very interesting.
And good luck with that.
And isn't it interesting that I'm talking about mycotoxins today?
Yeah.
She was in Italy. She was in the Peace Corps. Who knows?
Oh, yeah.
But here's the thing, John. As I said before, it's a disruptor. It can make our immune system either go to in overdrive or stop completely. And the idea is that's where sleuthing comes in. What we need to do, and at the same time, we've got to improve their quality of life. It's not enough to just test for this stuff. In the interim period, we've got to take what we know in our black bag that can help these people who have these problems and really look at what nutraceuticals and what kind of even pharmaceuticals we can use in a low dose manner to help this kind of patient. And I will tell you, Joanne, she'll tell you herself, she has lupus.
Yeah.
Okay? And there's no one, actually everyone in our facility works overtime. You know that.
Right.
And these are the volunteers. They work overtime. They love being there. So the bottom line is, a woman like her, she would need some B vitamins, and this is an important piece of the myotoxins as well. The mitotoxins. We'd have to look at detoxing. I love the fact that they're on juicing, but I'll tell you, it's what kind of juicing, how often you're doing this, and,
It sounds like it's not enough.
Correct. I think you're right on, okay? She may need milk thistle. She may need bitter herbs. She may need B vitamins. Phosphatidylcholine might be something. In other words, looking at these amino acids that I look at, there are so many things. And I'm going to tell you, the glutathione, Jerusalem artichoke, clean out that liver. There is so much that could be done for this young lady, and I would love to help.
Well, I hope she comes in.
And I do too.
We are coming up on our final break of the morning, but we still have plenty of time to take your calls at 855-839-1210. If you have a medical challenge or you want to just run something by Dr. Molly, 855-839-1210. Our program is called Health Watch. It's every Sunday, 8 till 9, right here on Talk Radio 1210, WPH.D. With Dr. Molly Fantasia, I'm your host, John DeMasi. We both return with more Health Watch after these words. We are back here on Health Watch. Again, operators standing by, and they'll be there well after we leave you at 9 o'clock. In fact, they work all day, okay? If you want to call them, 856 856-489-0505. Really, call and make that appointment for the initial consultation with Dr. Molly, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones. We have Catherine in Philadelphia. Catherine, good morning. Welcome. You're on with Dr. Molly.
Good morning, Catherine.
Good morning. Good morning, Dr. Molly. I don't know if you remember me, but before COVID, I came in to see you once.
You did. God bless you.
Yes, I did. Yes, I did.
Good.
And I
Good.
really liked you.
Good.
And I really
Good.
liked Barbara.
Oh,
and
she's
I had
the best.
A very nice conversation. How's she doing?
She's doing great. She's doing great.
That's
listen,
good.
Barbara knows how to care for. Listen, there's nobody as smart as Barbara where it concerns oral supplementation, and you know that, Catherine. May God bless.
I know. I believe it because she gave me something
I
that
know.
really helped me.
Of course.
And now it's been a long time since I've seen you. I have no
Good.
way to get to you.
Oh, I'm sorry to hear that.
The point of the matter is that whatever Barbara gave me, I would like to duplicate that because that really and truly helps me.
God bless you.
And then work on a way of how to get in to really see you because, Dr. Molly, as far as I'm concerned, you're aces in my book.
Aren't you the sweetest thing? You know, I'm working. You know, I have a driver who's been driving people around. We're working on possibly having him pick up some of my patients who having a hard time getting to me. Maybe from the train station or maybe from even where they are. We're trying to work all that out. Maybe, hopefully.
My difficulties, I'm in Philadelphia.
Yeah, no, that's where he comes from.
Yeah.
Actually, we have patients.
Oh, really?
Yeah. I have a lot of
that's
Philly
great.
patients. That's very good.
Yeah.
We're trying to work something out to do that. And he's been picking up a couple of my cancer supportive care patients. So we're trying to work something out for him to do this on a more regular basis. And again, how he came over to me was I treated him through COVID. So he just couldn't believe it.
Well, that's
and,
terrific.
And,
that's wonderful.
you know,
Thank
I love
God,
it.
Dr. Molly.
We try.
I do, and in the neighborhood that I live in, you're lucky you don't get AIDS. Never mind COVID.
Come on.
But the point of the matter
Hey, listen.
is that when I go
listen.
outside, everyone laughs at me. I wear masks and glasses and gloves.
That's good.
and
God bless you.
I really don't care.
No,
I really don't care.
You're
You can
taking
laugh.
care of yourself.
You're the
Right.
one that's sick, not me.
Right.
But
That's
my
right.
knees, Dr. Molly, they're
yes.
killing me.
I understand, and I think, you know, again, that's chronic. That's a chronic pain that really wears you down. Catherine, how old are you, may I ask? How old are you?
How old am I?
Yeah.
I'm 74.
God
I'll
love
be
you.
74 in August.
Let me
And
tell you
believe me,
something.
Dr. Molly, I don't like being this slow.
I believe you. I believe you with all my heart.
Catherine, I'll tell you what you do, all right?
Hey, listen.
Tell you what you do. Call Dr. Molly's office on Monday.
Yeah.
And talk to Barbara. She'll help you with that.
You know
and then
I'd
you
love
can
to
arrange.
speak to Barbara again.
Yeah,
Barbara-
you can arrange for
Barbara's a
the
sweetheart.
as Dr. Molly said. You can arrange for
Maybe
this
I can get
driver.
Tim.
Yeah,
Maybe I can get Tim to come and
so
pick you up.
We'll
so
arrange
it'll be
that
fine.
because
You're a good lady.
Tim's
God
on
bless
staff now.
he actually feels
Believe me, you
he
really
actually
are.
feels like he's on staff. I'll tell you. Anyway, listen, you're a lovely lady, Catherine, and God bless you, and thank you for the kind words.
Thanks for the call, Catherine.
They were kind words, John.
Yeah.
But, you know, we do try to help everybody if we can in one way or another. And again, listen, you cannot throw away your traditional drugs. But there are many, many ways to have them do work and also work with what we do to have a significant impact on your immune system. And I'll tell you, John, pain is something we work with all the time. The immune system problems, the autoimmune, when the body turns against itself. But it all has one thing in common. You might know it, inflammation.
That's right.
And so inflammation, I say over and over again, is not a good thing. It's scheduled to be a good thing. It's an innate thing that God has given us, and hopefully, you know, it works when it works. But when it goes into overdrive, you've got problems. And what I was talking about earlier in terms of exposure to mold and fungus and certain bacteria, it causes the body to really have a problem and therefore either go into overdrive or underdrive, which is equally as bad. Because when you don't have enough of your immune system, you're feeling pretty lousy as well.
Anything you want to add to what you were talking
Well,
about
yes,
before?
there are probably over 100 different citations on PubMed and various abstracts trying to understand mycotoxin-induced illnesses, or syndromes, as I like to call them. And it's something I want people to think about. You may not even know you had an exposure because, again, sometimes it's in food, as simple as some things that we're eating. They found it in some cereals. So I want people to realize that you may have an exposure that you don't even know, and it could be contributing to your particular challenge. And in that regard, we know we can help. And once we try to do the archaeology of this, finding out what was the underlying issue, we then can help you improve your quality of life, get you on the right track, and let's put some of these challenges behind you.
You were telling me before the show, did we talk about this, the woman with the skin?
Yeah, she's one of the patients that I talked about that said that she had the problem with Sandy, and she definitely had the mold exposure. But again, I think most of the physicians and most of the places are looking at that and saying that's behind her. And yes, it is. She had a total remediation. But I'm worrying about her having some specific mycotoxins that are, as a result, that are leaving her with these skin conditions that become autoimmune in nature. It's very complex.
It's kind of like it's lingering?
It's lingering. What's happening is she's having these problems, and it's the formation of these mycotoxins, and we can test for them, but to get to that test is very, very involved. And that's really where I'm thinking I want to go with her next. She does have an appointment with a rheumatologist. I'm glad she's going. But honestly, I think in the end, we're going to need to do more archaeology on her previous history and then put together a specific protocol that can be effective for her skin. And it may not be perfect, John. It may never be perfect.
I said this last week. You're like a detective.
Sometimes, yes.
You really got to study this thing because it's a very complicated.
And we've got to run it through all of our meetings with the physicians and talk about what else. Are we missing anything? I mean, we really try to look at some of these cases week to week.
And any more?
I think.
Here.
Well, we also this week, of course, I had my standbys, my old standbys. I just spoke to Pam today, who's my cancer survivor all these years. She's very, very smart. She knows how to eat well, take care of herself. She's in once a week in our facility, and as a result, I really believe we have helped her maintain her health status, even though she had breast cancer.
And her husband comes in.
Oh, yeah. I have a family affair. Yeah. We're truly a primary care facility.
And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, if you want to make an appointment with Dr. Molly, the initial consultation is complimentary, 856-489-0505. That's 856-489-0505. And that's how you make the appointment with Dr. Molly. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel, and then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.